At 4 years old, Sebastian Stazali's speech and mobility are affected by a rare genetic condition, type 1 spinal muscular atrophy, SMA. Sebastian wasn't diagnosed until he was 4 months old though, and that was because his mother insisted he was tested.
I was taking him to a baby group and I was watching other children week on week move more. And Sebastian was so animated in his face, really smiley, giggly, happy baby, but he just wasn't moving. It was literally just feeling like something quite wasn't right.
Unlike in many other countries though, SMA is not included in the UK's newborn baby screening programme, the heel prick test, despite there now being treatments, including a gene therapy, which can halt the disease progression. Time, though, is of the essence. Sebastian was treated at 5 months old and already he'd lost some muscle function.
This in itself is phenomenal because he's able to sit. He can eat, he can breathe independently.
But let's be very frank, right? If he got it earlier, he could be walking. He currently, if I list you amount of specialists we are using or seeing, it's 10 different ones. You've got orthotist, physio, OT, speech and language. Then we've got respiratory physio. So that's just physiotherapists. Then you're going doctors like neuromuscular doctor, pediatrician.
Hip clinic, spine clinic.
Hip clinic, spine clinic. He just had a hip surgery and things like this.
We have some of the best treatments for loads of conditions, and we have such an issue with diagnosis. And all we have to do is add SMA to the heel prick. Yeah. That's literally it.
5 years ago, the UK National Screening Committee decided not to recommend adding SMA to the heel prick test. Then 2 years ago, they said they would do an in-service evaluation to gather evidence. But that hasn't started. And when I asked the Department of Health why there'd been a delay, they didn't answer the question, nor did they answer why it's been scaled back from UK-wide to just 60% of England.